Did you know that implicit bias in clinical algorithms has led to the unnecessary discarding of kidneys from Black donors? Stay tuned to uncover the hidden dangers of implicit bias in healthcare. Hi, I'm Tamisha Campbell, and I am the host of Health Equity Talks. And on this channel, we help healthcare providers address implicit bias and promote health equity. And in today's video, we're going to break down the implicit biases hidden in clinical algorithms, explicitly focusing on the Kidney Donor Profile Index, or KDPI. We'll explore what went wrong and how we can address these biases moving forward. And make sure you stick around until the end, because I'm going to share a valuable resource to help you further tackle implicit bias in your organization. Let's get to the details. Here are the key points we're going to cover today. Understanding implicit bias in healthcare, the KDPI algorithm's flawed assumptions, the impact on Black patients, and steps toward equity. First, we must understand implicit bias in healthcare. Implicit bias is unconscious attitudes or stereotypes that influence our decisions and actions. And these biases can affect diagnosis, treatment, and patient outcomes in healthcare. Second, we must examine the KDPI algorithm's flawed assumptions about Black folk. The KDPI was designed to predict the longevity of donated kidneys. However, it included race-based criteria that falsely assumed Black kidneys were less viable than kidneys of other races, and this led to higher discard rates. Third, we cannot ignore the noticeable impact of the KDPI algorithm on Black patients. As we know, Black patients already face higher rates of kidney disease and longer wait times for transplants. As a result of the bias embedded within a KDPI algorithm, Black patients were further disadvantaged by an already inequitable healthcare system. And lastly, knowing the flaws embedded within the system, we must take conscientious steps toward promoting health equity. Do that by addressing implicit bias through a multifaceted approach that prioritizes implementing comprehensive training programs for staff. And through training and education, healthcare organizations can focus on reorganizing and addressing implicit biases in their daily operations. And by this, I mean explicitly considering the inherent biases that are embedded in the policies and practices within our healthcare systems. Because unless we're open to recognizing that, we will only continue perpetuating the harm we are fighting to address. Regularly reviewing and updating clinical algorithms. Due to algorithmic bias, it is not uncommon for certain algorithmic decisions to systemically disadvantage certain groups, such as Black populations. Therefore, regularly reviewing clinical algorithms ensures that we can make necessary adjustments and take steps to improve health outcomes. Engaging with diverse communities to build trust and improve care. A lack of transparency in our healthcare system, specifically regarding Black patients, leads to a lack of trust between Black patients and providers. Therefore, transparency in how data is being collected and used is essential. Consider the case of a Black donor whose kidney was discarded based on the KDPI's bias criteria. This decision impacted both the donor's family and the potential recipient, highlighting the real-world consequences of implicit biases. Now, as promised, here's something valuable for you. I've compiled a list of the top resources and tools to help your organization identify and address implicit bias. This includes videos, articles, books, training modules, and community engagement strategies. Download your free Implicit Bias in Healthcare resource guide. The link is in the description. And if you found this video helpful, please like, subscribe, and share it with your colleagues. To stay informed about the latest research and trends in healthcare equity, sign up for our weekly EBWH community newsletter. You'll get exclusive content and updates on upcoming training sessions. Sign up for the EBWH community newsletter. The link is in the description. Thank you for watching this episode of Health Equity Talks, and we look forward to seeing you next time. Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.